Hi, this is Shelby again. This is part 2 of the pre-cycle workup for IVF. So I had been telling you guys about my new patient pre-cycle testing. This is basically what you do when you're the initial steps for your cycle. So I told you guys about that you're supposed to call the office on cycle day 1 and schedule your blood test and an ultrasound. Then you're also supposed to schedule a water ultrasound on day 6 of your cycle, which I actually did last month because I was going to do my cycle, my IVF cycle. The transfer would have been this month, but then we had like a snafu, so we couldn't do it. So the water ultrasound is basically after, on your actual menstrual cycle, like the week after your bleeding stops, they want you to go in, at least my doctor, and they do this water ultrasound, and they actually take like saline or whatever, and they insert it through the hoo-hoo and fill up your uterus, and then they do an ultrasound, and they can see the inside of your uterus, and they can see where basically if you have any adhesions or any stuff that's not supposed to be in there, and they can look and know where exactly they want to transfer the eggs when they do the actual fertilized egg transfer. And they didn't really tell me very much about what it would feel like, so I just thought like, oh, they're gonna it'll feel like if you've ever douched or something, it'll feel like that. No, it does not feel like that. It hurts. They take like this huge syringe, and I'm a nurse, okay, and this syringe was big. It's like the biggest syringe that they make, and it has like a flexible tip, and they insert that through your cervix, and that part's a little bit uncomfortable. But when they start pushing in this water, which is, by the way, cold, it fills up your uterus, and it feels like the worst menstrual cramp that you've ever had. Like I had to like control myself from like trying to kick at this girl who was pushing this water in, because it hurt really bad. And then so they like do the ultrasound and everything of course was fine. She was like, oh, you have a nice uterus, and I was like, thanks. And then it kind of like starts coming out again, which I wasn't expecting that either. I didn't come prepared. Like, I don't know why I didn't think that. Like, oh, they're going to shoot me full of water. Maybe I should bring, like, a maxi pad or something. And I didn't even think about it. I mean, I was, like, wearing a thong and everything. Like, I was totally unprepared. I wish they had, like, a little packet. Like, this is what an water ultrasound is. Come prepared. And, yeah, so I wasn't prepared. So it's, like, starts gushing out at me, which is embarrassing. I felt like I was giving birth because it was, like, hitting the floor and stuff. They should have told me this kind of stuff. That would have been nice. But yeah, so that part was over. And I actually cramped for the rest of the day. Like, it hurt the worst, like, when they finished filling up my uterus with water. But I basically cramped for the rest of the day and for a couple days after. And then I bled a little bit. Like, I went on what would have been cycle day 7, maybe. And so I was done bleeding, but I bled for, like, 2 more days, like, just spotting after that, which I also wasn't prepared for. But getting back to this one, the water ultrasound would be during the second week of your menstrual cycle. And then they do a plan of care appointment, which is kind of near the end of that first menstrual cycle. And the plan of care appointment is something I'm really excited about, because they tell you exactly what's going to happen basically for the next 2 months of your life, because it does take over. They give you all your scripts for your medication, prescriptions. They set up all your appointments for your ultrasounds and your labs and everything, and then you kind of get a better idea of when everything is going to happen. So I'm really excited about that. Like, and I'm trying to get my husband to go too. Like, he wants to go, but of course it's at like 1 o'clock in the afternoon on a Tuesday, so he would have to take off work. But I'm trying to get him to go, because I think that would be really important for him to see that. What else? The only other thing that I've done through the office and everything, one of the tests that they drew the lab test that they took on our very first just interview consultation was testing for immunities to like normal vaccines as you take as a kid. And my MMR was not up to par, like I had fallen below the immunity level, so they wanted me to take that again. So I did have to go in and take that vaccine, which I wasn't expecting, but I guess that's a good thing, you know, because they do it so that if you do get exposed when you're pregnant, you don't pass on a disease like that to your baby. They give you a lot of books and stuff, which, I don't know, as a nurse, like, to me, that's just, that'd be nice for people who don't have that much medical knowledge. They gave us a couple of, like, this is the, how much time do I have? This is the pamphlet for the company that does financing for fertility. The company is Springstone Patient Financing. It's called Attain Fertility Centers. And this is the one that we're going to do for to help us pay. See, the APR is 4% to 18%, and you can take up to $40,000 if you want to. And I don't know where, like if you live in the same area as I do, or if they are nationwide, but that's the information, which I thought was awesome, because like when I was researching, not very many people talked about like loans. Everyone was just like, oh, they borrowed from their parents and stuff. It's nice to have rich parents. I don't. But that's the fee schedule. You can see we're going for the 48 months one, which we're going to take $10,000, so that's $241. But, you know, that's a relief to know that you can take out a loan for something like that. I mean, we'll have to work that into the budget and be good and stuff, and it kind of sucks to be like, well, if you don't get pregnant, then you still have to pay for it, and if you do get pregnant, then your income is reduced. But, you know, I think any woman such as myself and anyone going through IVF is willing to make those sacrifices. Like some book that I was reading was saying, you know, the men, when they're looking at IVF, they want to look at the numbers and they want to crunch them, and they want to crunch them again, and then they want to crunch them again to make sure that they can afford it. And the women are more like, I will beg, borrow, or steal to make this happen. That's exactly what me and my husband are like. But and I've made another long video, but that's pretty much, I think, I went round and round. I didn't go through very organized through how we went through our IVF workup, but that was most of it. If I think of anything else, I will make another video. And if you have questions, or I didn't make myself clear about something, ask a question. That would be cool. Thank you for watching. Have a good day. Bye.